Welcome back. How would you like to feel, I don't know, 3 decades younger? Lose some weight, reduce the cellulite, gain some energy, you name it. And our anti-aging specialist, Dr. Mario Juarez, he can make it happen for you. Please welcome the man, the myth, the legend, Dr. Juarez. We're so happy that you're here.
Thank you so much for having me here.
You have an amazing place. It's called Our Creations Medical Spa, and you offer so many different things.
We do.
One of them is it's for weight loss. You have a couple of programs that are very popular and people are seeing great results with.
Right. We have the ACG weight loss program, which is it's a very popular program now in this country. As you know, obesity is #1 problem in the country, and it leads to major illnesses. But we have an incredible ACG program. It includes minor injections, small little injections for 30 to maybe 42 days. And people do wonderful. You can lose a pound a day, Kimberly.
I have heard of this, the HCG, and you're saying it really is phenomenal then.
Absolutely.
And these are some pictures we have of your patients.
Yes, that's a patient.
Before and after.
That's one of my patients. He's in the Caribbean, as you can see.
He looks like he's having a good time.
Right. This gentleman lost 100 pounds on my lipo diet. That's my other diet, Kimberly. And the lipo diet is a fat-burning diet. I educate my patients. It's physician supervised, physician. It's all monitored by physicians.
That's what's so great is that this isn't just a quote-unquote spa. You have a doctor, a medical doctor, helping you lose the weight.
In anti-aging.
And
that's the beauty.
Helping you look 30 years younger. So you have that, you have laser beauty, you have the cellulite reduction treatment. You and I will talk about that after the break. Also, you have hormones. You work with hormones to help people feel so much better, much younger.
Yeah, these are bioidentical hormones. These are not synthetic hormones. Synthetic hormones have the negative part of them is they cause breast cancer. They cause adverse problems with people. It's incredible. And people have been taking them. Women like you, Kimberly, have been taking hormones, birth control pills, et cetera, et cetera. We use bioidentical hormones. They come from natural sources, plants. They're so identical to your body.
See, people hear hormone replacement and they think, oh, because it has a stigma attached to it.
Exactly right.
But you're saying this type, and what is the name of the type of hormone treatment you do?
It's bioidentical hormone treatment.
Bioidentical.
Exactly, and it's you can do it in cream form, transdermal, or you can do it by oral medication.
Really?
It's incredible. It gives you energy, libido.
Did you bring any with you?
Weight loss. I did not bring. I applied mine this morning, and I love it.
Can I tell everyone? Because you told me how old you were. And
exactly. I just turned 65 this last weekend.
Living proof right here.
Right. And I enjoy. I have a passion for medicine, but now I actually love this branch of medicine because it does rejuvenate you and it keeps you healthier and it keeps you away from diabetes, cardiovascular disease, stroke, et cetera, et cetera. It's incredible.
Yeah, it's not just looking better on the outside, it's your inside.
It's exactly right. It's not all about the outside. It's about my purpose. Beauty is beautiful, but I like the inside. I like my bones to be
and I want to be around a long time.
Absolutely, in a positive manner.
And look good while I'm around a long time.
Exactly.
Well, hey, you have got to go and see Dr. Juarez. Again, it's called Our Creations Medical Spa. We're back with our anti-aging specialist, Dr. Mario Juarez, with Our Creations Medical Spa, and he's here with one of his patients, Jeff Cummings, who he is a living proof that you really can feel 30 years younger with the hormone therapy that Dr. Juarez provides.
Absolutely.
What's your story? I mean, because when you think of hormone replacement therapy, you think of women. You really do. You don't think about men getting it.
That's exactly right.
Were you feeling sluggish? Like, what was going on with you that made you think, I need to go and...
Pretty much everything was sluggish.
Everything.
Yeah, when I could attest to that. I was way overweight. I needed a nap in the afternoon. I wasn't motivated. And I needed something, and somebody referred me to Dr. Juarez and went in and spoke to him, and he said, well, first off, we got to get the weight off of you. And then I'm an HCG candidate. So I've lost about 35 pounds. And it really wasn't as hard as I thought it was going to be because of the program that he puts you on. And if you do what he tells you to do, if you follow the instructions and follow the program, you will lose the weight.
You have to be dedicated, though.
Oh, you got to be committed.
And you got to want it.
After a while, then he talked to me. He said, you know, Jeff, I think we need to check. And they did a series of tests on me to find out where I might be low in my in hormones, and sure enough, I was. He said, matter of fact, he said, you're on vapors.
Oh,
He said,
no,
you need to pull into the
fumes.
Valero and get filled up.
You're running on fumes, Jeff.
Exactly right.
So then you started with the hormone.
He told me within 30 days, he said, you're going to feel like 25.
And?
I can attest today that I feel about 30.
Really?
I'm about 5 years away from that, but I'm good.
That is
There you go.
amazing that you feel so good.
I only
because-
have one regret.
What's that?
I didn't do it before my honeymoon.
Oh, man.
Well, you're better
Oh, well.
though.
You're good. You're good. You got plenty of time.
Yeah.
So, again, what's the difference between the hormone therapy with women versus men? How is it different?
Okay. There's we test both men and women with saliva. That's the important thing I think people need to understand. Versus a synthetic that, and a lot of men, a lot of physicians test their patients with blood. Blood is not as precise. So we try to find the hormone level in the cell. Therefore, we do saliva testing, and it's well known in anti-aging and my medical colleagues that that's the gold standard to test hormones correctly. And then we go ahead and find your deficiencies.
Yeah.
Kimberly.
What's the most common for when we're running out of time? But what's the most common deficiency for a woman and the most common for
Most
men?
common deficiency for a woman is estrogen and progesterone.
And then for men?
For men, it's testosterone.
Always.
But you have to be careful with the testosterone that's given out there because there's a lot of,
Yeah.
fly-by-night centers that are giving just wrong testosterone.
Well, and that's what's different about our creations. You have a medical doctor that is going to be taking care of both for
Awesome.
being
Thank
here.
you.
So nice
Thank
to meet
you.
you, Jeff.
Yes, ma'am.
Congratulations with all that energy.
Thank you.
On that
Thank you, Kimberly.
youthful feel you got going there.